Top 30 Hospital Cleaner Interview Questions and Answers. Working as a hospital cleaner requires dedication, attention to detail, and a strong sense of responsibility. Cleaners in healthcare facilities play a vital role in maintaining hygiene, preventing infections, and creating a safe environment for patients, staff, and visitors. During interviews, candidates are often asked questions that test their cleaning skills, knowledge of safety practices, and reliability. Below are 30 commonly asked hospital cleaner interview questions with thoughtful answers that can help you prepare effectively. 1. Why do you want to work as a hospital cleaner? I want to work as a hospital cleaner because I understand the critical role cleanliness plays in healthcare. Maintaining high hygiene standards helps protect patients and staff from infections and ensures a safe healing environment. I take pride in knowing that my work directly supports patient recovery and hospital operations. I enjoy working in structured environments where my efforts contribute to something bigger, and this role allows me to serve the community meaningfully. 2. What do you know about infection control? Infection control refers to the practices used to prevent the spread of harmful microorganisms in healthcare settings. As a cleaner, I must follow strict protocols such as using disinfectants, wearing protective gear, and disposing of waste safely. I understand that proper cleaning reduces the risk of hospital-acquired infections. I would ensure surfaces, patient areas, and high-contact points are sanitized regularly. Infection control is not just a task. It's an ongoing responsibility that supports health and safety. 3. How do you handle cleaning tasks under pressure? When faced with pressure, I stay calm, focused, and prioritize tasks effectively. I break down my work into steps, ensuring that essential areas such as patient rooms and restrooms are cleaned first. I rely on planning and time management to complete my duties without compromising quality. If necessary, I communicate with supervisors to adjust schedules or get support. My goal is to maintain high standards of cleanliness even when deadlines are tight or demands are high. 4. How would you clean a room where a patient with an infectious disease was treated? I would begin by wearing appropriate personal protective equipment, PPE, to ensure my safety. Next, I would follow hospital protocols for cleaning such areas, using hospital-approved disinfectants on all surfaces, including floors, beds, and touch points. Waste would be disposed of in designated biohazard bags. I would work carefully to avoid spreading contaminants and double-check high-touch areas like doorknobs. After cleaning, I would properly remove PPE and wash hands thoroughly, ensuring compliance with infection control standards. 5. What steps would you take if you encountered a biohazard spill? If I encountered a biohazard spill, I would immediately restrict access to the area and alert my supervisor. I would put on the required protective gear and use hospital-approved cleaning solutions designed for biohazards. Carefully following spill management procedures, I would clean the affected area thoroughly, dispose of waste in designated containers, and disinfect the space. Finally, I would report the incident, complete any documentation required, and ensure the area is safe for patient and staff use. 6. How do you ensure you don't miss any areas when cleaning? To avoid missing areas, I follow a systematic cleaning routine, working from top to bottom and left to right. I use hospital checklists to ensure each step is completed and pay special attention to high-contact surfaces such as door handles, switches, and bed rails. Regular inspections help confirm thoroughness. I also review feedback from supervisors and coworkers to improve my methods. This disciplined approach ensures consistency and helps me maintain high cleanliness standards in all assignments. 7. How do you deal with unpleasant odors while cleaning? Unpleasant odors are common in hospitals, and I handle them by using appropriate cleaning products designed to disinfect and neutralize smells rather than just masking them. Proper ventilation also plays an important role, so I ensure windows or air systems are functioning. I understand that odors may indicate contamination, so I take extra care to clean thoroughly. Additionally, I remain professional, focusing on the task, since patients and staff depend on a hygienic, fresh-smelling environment. 8. How do you handle patient privacy while cleaning? Respecting patient privacy is crucial in healthcare settings. I always knock before entering a patient's room and introduce myself clearly. If patients or medical staff request time alone, I politely step out and return later. I avoid discussing patients or their conditions with others, ensuring confidentiality is maintained. While working, I focus strictly on cleaning tasks without interfering with medical care. Professionalism and respect guide my behavior, ensuring that patients feel comfortable and valued. 9. What protective equipment should a hospital cleaner use? Hospital cleaners must use personal protective equipment, PPE, such as gloves, gowns, masks, and sometimes face shields, depending on the task. PPE protects both the cleaner and others from contamination. For tasks involving chemicals, safety goggles may be necessary. When cleaning areas with infectious risks, proper disposal of PPE after use is mandatory. I understand the importance of wearing, removing, and disposing of equipment correctly to maintain safety and prevent the spread of harmful microorganisms. 10. How do you stay motivated during repetitive tasks? I stay motivated by remembering the importance of my work in supporting patient care and hospital safety. Even though cleaning can feel repetitive, each task contributes to preventing infections and improving health outcomes. I take pride in leaving an area spotless and organized, which gives me personal satisfaction. Additionally, I set small goals for myself throughout the day and use them to stay focused. Knowing I am part of a larger healthcare team inspires consistency. 11. Describe how you clean and disinfect medical equipment. Cleaning medical equipment requires careful attention to detail and adherence to hospital protocols. First, I wear appropriate protective gear. Then, I clean the equipment with approved cleaning agents to remove dirt or organic matter. After that, I apply disinfectant, ensuring proper contact time for effectiveness. I handle equipment gently to avoid damage and only use recommended products. Finally, I document the cleaning if required, making sure the equipment is safe, sanitized, and ready for patient use. 12. How do you prioritize cleaning tasks in a hospital setting? I prioritize cleaning based on urgency, safety, and hospital guidelines. High-risk areas such as operating rooms, emergency areas, and patient restrooms always come first. Next, I move on to waiting rooms, hallways, and offices. Within each area, I pay attention to high-contact surfaces like bed rails, door handles, and switches. I also respond promptly to urgent cleaning requests, such as spills or contamination. This structured prioritization helps ensure critical areas are always hygienic and safe for use. 13. How would you handle a situation where a nurse urgently asks you to clean an area while you are already busy? I would politely acknowledge the nurse's request and assess the urgency of the task. If the new request involves a spill or contamination, I would immediately prioritize it because patient safety comes first. If less urgent, I would explain that I will complete my current task quickly and then attend to it. I would also inform my supervisor if multiple urgent tasks conflict. Flexibility, communication, and prioritization ensure all important tasks are handled appropriately. 14. How do you clean high-touch surfaces effectively? High-touch surfaces require frequent cleaning and proper disinfectants. I clean these areas using hospital-approved solutions, applying enough product for effective disinfection and allowing proper contact time before wiping. Items such as door handles, elevator buttons, switches, and bed rails are cleaned multiple times daily. I use color-coded cloths or disposable wipes to prevent cross-contamination. Regular monitoring and repetition are important since these surfaces carry a high risk of germ transfer. This method ensures patient safety consistently. 15. What cleaning chemicals are commonly used in hospitals? Hospitals use disinfectants such as bleach solutions, alcohol-based cleaners, hydrogen peroxide products, and quaternary ammonium compounds. These chemicals are effective against a broad range of bacteria and viruses. I understand the importance of using the right product for each surface and following dilution instructions carefully. Safety data sheets help guide correct handling. I also wear protective gear to prevent exposure. Using the right cleaning chemicals helps ensure hospital environments remain hygienic and safe for patients and staff. 16. What steps would you take if a patient asked you to clean something outside your usual duties? If a patient asked me to clean something outside my regular responsibilities, I would listen respectfully and assess the request. If it is within my scope and safe to handle, I would complete the task promptly. If it involves medical equipment or areas requiring specialized staff, I would explain politely and inform the appropriate personnel. Clear communication ensures the patient feels heard while maintaining safety and following hospital protocols. My goal is always patient comfort and safety. 17. How do you protect yourself from harmful chemicals during cleaning? I protect myself by wearing personal protective equipment such as gloves, masks, and goggles, depending on the chemical. I always read and follow instructions on labels and safety data sheets. Proper ventilation is important, so I ensure windows or exhaust systems are functioning. I never mix cleaning products unless explicitly directed by hospital protocols. After handling chemicals, I wash my hands thoroughly. These safety practices protect my health while allowing me to perform cleaning effectively. 18. What should you do if you accidentally touch contaminated material? If I accidentally touched contaminated material, I would stop working immediately and wash the affected area thoroughly with soap and water. I would then inform my supervisor and follow hospital protocols, which might include reporting the incident and seeking medical attention if necessary. I would also replace gloves or protective gear before continuing work. Handling the situation quickly and responsibly ensures my safety and prevents further contamination in the hospital environment. 19. How do you ensure your cleaning contributes to patient safety? My cleaning contributes to patient safety by following strict infection control protocols, using proper disinfectants, and focusing on high-risk areas. By removing harmful microorganisms from surfaces, I help reduce hospital-acquired infections. I also ensure proper waste disposal and maintain organized, clutter-free spaces that minimize fall risks. I recognize that patients may have weakened immune systems, so even small details matter. My attention to thoroughness and consistency directly supports patient safety and the hospital's mission. 20. How would you respond if a supervisor pointed out an area you missed? If a supervisor pointed out an area I missed, I would thank them for the feedback and correct the mistake immediately. I view such feedback as an opportunity to improve my performance. After addressing the issue, I would reflect on how it happened and adjust my routine to prevent repetition. My goal is always to learn and grow in the role, ensuring consistent quality. Maintaining a positive, professional attitude toward corrections is very important to me. 21. How do you handle waste disposal in a hospital? Waste disposal in hospitals requires strict adherence to safety protocols. I separate regular waste from biomedical waste, placing sharps, contaminated materials, and body fluids in designated biohazard containers. General waste goes into standard bins. I seal and label containers properly before transporting them to disposal areas. Wearing protective gear is essential to avoid exposure. Following these procedures prevents infections, protects staff and patients, and ensures compliance with hospital regulations and environmental safety standards. 22. How do you handle situations where patients or visitors interrupt your cleaning? If interrupted, I always remain polite and respectful. Patient comfort and safety are priorities, so I pause my cleaning and listen carefully to their needs. If the request is urgent and within my responsibility, I address it immediately. If it requires medical staff, I politely redirect them to the right person. Once the situation is resolved, I return to my cleaning tasks. Flexibility and good communication help balance cleanliness with patient-centered service. 23. What experience do you have with cleaning schedules? I have experience following structured cleaning schedules that outline specific tasks and times for each area. I understand the importance of completing tasks consistently and documenting them as proof of compliance. I also adjust schedules when unexpected needs arise, such as spills or urgent requests. I believe that sticking to schedules improves efficiency, ensures no area is missed, and allows supervisors to monitor performance. I am organized and reliable, which makes me effective with schedules. 24. What would you do if you noticed damaged cleaning equipment? If I noticed damaged cleaning equipment, I would stop using it immediately to avoid accidents or ineffective cleaning. I would report the issue to my supervisor and, if possible, tag the equipment to prevent others from using it. Meanwhile, I would use alternative tools or request replacements to ensure my work continues. Regular equipment checks are important, so I remain attentive to such issues. Properly maintained equipment ensures both safety and cleaning efficiency in hospitals. 25. How do you clean restrooms in a hospital setting? Cleaning hospital restrooms requires strict attention to hygiene. I begin by wearing protective gear, then empty trash bins and restock supplies like soap and paper towels. Next, I disinfect toilets, sinks, and faucets thoroughly, paying attention to high-touch areas like flush handles and door locks. Floors are mopped with hospital-approved disinfectants. Finally, I check for odors and ensure everything is sanitized and presentable. Regular cleaning throughout the day ensures restrooms remain hygienic, safe, and welcoming. 26. How do you maintain confidentiality as a hospital cleaner? Maintaining confidentiality is vital in a hospital. I never share or discuss anything I might overhear about patients, their conditions, or staff conversations. While working, I focus strictly on my cleaning duties without intruding into private matters. If I accidentally see or hear sensitive information, I treat it as confidential and do not repeat it. By maintaining discretion, I help uphold the trust patients place in the hospital and ensure compliance with confidentiality standards. 27. What do you do if a patient becomes upset while you're cleaning their room? If a patient becomes upset, I stop cleaning and calmly listen to their concerns with respect. I apologize for any inconvenience and explain my role briefly, emphasizing that I want to ensure their room remains clean and safe. If they request privacy, I step out and return later. My goal is to maintain a positive atmosphere and support their comfort. Sensitivity and patience are important when working in environments where patients may feel vulnerable. 28. How do you manage teamwork with other hospital staff? I believe teamwork is essential in a hospital setting. I communicate clearly with nurses, doctors, and other cleaners to coordinate tasks effectively. For example, I wait for medical staff to finish before entering a room or adjust my schedule based on patient needs. I also share updates on completed work to keep everyone informed. Respect and cooperation help maintain smooth operations. By working well with others, I contribute to a supportive and efficient hospital environment. 29. How do you stay updated on hospital cleaning standards? I stay updated on cleaning standards by attending training sessions, reading hospital policies, and reviewing safety updates. I also pay attention to any new infection control guidelines issued by health authorities. If my supervisor provides updated protocols, I follow them immediately. I believe continuous learning is important, especially in healthcare where standards evolve. Staying informed ensures I use the correct products, techniques, and protective measures to keep hospital environments safe and compliant. 30. Why should we hire you as a hospital cleaner? You should hire me because I am reliable, detail-oriented, and committed to maintaining high cleanliness standards. I understand the importance of infection control and patient safety in healthcare environments. My experience and discipline allow me to complete tasks efficiently without missing details. I am flexible, respectful toward patients and staff, and eager to contribute to the hospital's mission. I see this role as more than cleaning. It's about supporting healing and protecting health daily. Hospital cleaners are essential to healthcare operations, ensuring facilities remain hygienic, safe, and welcoming. Interviewers want to see that candidates understand infection control, prioritize tasks, and work well under pressure. By preparing for common questions like the ones above, you can demonstrate professionalism, reliability, and dedication to high standards. A strong interview response highlights not just cleaning skills, but also teamwork, confidentiality, and patient-centered service, making you a valuable member of the hospital environment.